Developing right now, the CDC is tracking measles cases across the U.S. and right here in Georgia. 555 individual cases since the start of the year. That is the highest number since 2000. CBS 46's Vince Sims joins us now live to show us how we can find out if we're at risk. Vince?
All right, well, the measles, it's very contagious. It can be spread through the air. Now, vaccinations can prevent it. But however, simple blood tests, like you can get at a clinic right here, will let you know if you've been vaccinated for the disease or if you may have it. The Centers for Disease Control and Prevention is putting out the word that measles cases are coming back strong this year. People are getting the warning. Have you heard about measles or measles outbreak?
I have. I actually saw an article online.
I discovered in CDC data 555 cases in 20 states are confirmed. This is the second greatest number of cases since 2000. Georgia and Florida are two of those states in our area with cases of the measles, and that worries some people.
Yeah, I've heard about it. I've been following it on the news, and I'm very concerned about it, obviously because of my general health and welfare, as well as my family.
That concern has some people looking for ways to find out if they're at risk.
Measles is not one of those things that you see often. So since then, people are coming in to verify whether or not they are immunized or whether or not they actually have the measles itself.
Lucretia Waller is an office medical assistant with any lab test now. They can run a test to see if you have the measles, if you have symptoms, or they can test to see if you've had your immunization. Since no patients were coming through while we were working on the story, I decided to roll up my own sleeve and let them do a blood draw on me so you could see the process.
We'll do a blood venipuncture on you and process the specimen, ship it to the lab, and when it's resulted in 1 to 3 days.
Many reasons can factor into increased measles cases. More travelers get measles abroad and bring it into the U.S., further spreading measles in communities of unvaccinated people. The majority of people who got measles were unvaccinated.
Because I'm afraid of the anti-vaxxers that are not having their children and their babies vaccinated, and that harms the rest of us.
All right, so if you have been vaccinated for the measles, you do not need a booster shot. However, a very few people that have been vaccinated, about 3 out of 100, can still get the measles. Well, the good news there, they don't really know why that happens, but the good news is the fact usually the symptoms are milder and you're less likely to be able to spread that to someone else. Reporting live, I'm Vince Sims, CBS 46 News.